Hi, my name is Talitha Montesi. I'm a student at Colorado Christian University. Today I'm preparing a demonstration speech for my oral communications class. In my audience is Andrew and Jacob. Please say hi.
Hello. Hi.
Thank you. Okay, let's get started. So, anybody interested in being a hero?
Of course.
Of course, me too. There are all kinds of ways to be heroes. You can call in a fire and save somebody from burning. You can save somebody's life. You can make the winning score in a basketball game. All kinds of things. But today we're going to talk about being a hero, specifically as it relates to saving somebody's life. Imagine this with me, all right? You're in the gym doing a good workout, right in the middle of a great workout. Your legs are burning, and you notice in the corner of your eye, the guy over on the treadmill just collapsed and got flung to the floor. All of a sudden, you run over there. You're not really sure what to do. Your heart starts racing. You're kind of in a panic. Somebody else is next to you, and thankfully, they speak up and say, "He's not breathing. Call 911." So you race up the stairs to the front desk and deliver the message. Not sure what to do next. You kind of sit there. Your heart's still racing and pounding. The staff member runs past you with a little lunchbox device in his hand, runs down to the guy, and quickly attaches it. You see a bunch of commotion around him. By the time the ambulance arrives, they go downstairs and they package up the guy, and as they're bringing him up the stairs, he's breathing. You're very thankful and you breathe a sigh of relief. But you feel a little guilty because you really just didn't know what to do. So today, we're going to talk about what to do when you see somebody collapse in a scenario like that. Now, you might not think this is very likely to happen to you. However, according to the American Heart Association, 300,000 to 400,000 people every year in the U.S. alone die from sudden cardiac arrest or the heart stopping. And of those numbers, the 300 to 400,000 people, 88% of them happen outside of the hospital. So how likely do you think it is that this might happen to you?
Pretty likely.
Maybe a little bit. We hear news stories about it happening every once in a while. If it does happen, it sure would be great to know what to do. So today, we're going to talk about how to attach an AED. The great thing about AEDs is science has said that these are so effective that they've now been approved by the government, and they're in many public facilities. When you're out and about, you may see them in airports, in airplanes, in recreation centers, in shopping centers, in churches, in schools. So start to kind of keep your eye out and look for these little devices. They're pretty fool safe. Before we decide that we need to use one of these, what we first need to determine is if the victim is dead, if they have suffered sudden cardiac arrest. Now, there's a really easy way to figure out if somebody's dead. Does anybody have any ideas? Let's pretend I'm this guy here. What's that?
See if they're breathing or not.
See if they're breathing or not. That's an excellent idea. So how would we do that? Come show me. How might you see if somebody's breathing or not?
You might put your head down, and so your face is looking right directly over their chest to see if it's moving over or down.
Excellent.
Or put your hand over your mouth, over their mouth, to see if there's any heat.
Excellent. Just like you would check on a little baby if they're sleeping to see if they're still breathing. We're going to do the same thing. So once we've determined that somebody's not breathing, and maybe we've checked to make sure, hey, and they haven't done anything, then we've determined that this is a pretty good sign if they're not breathing, they're not moving, that they're dead. So now's a really great time to call 911 and see if there is an AED in the public facility that you're at. If there is one, we need to discuss 4 things that we need to look for very quickly before we actually attach this AED. One thing is, if this patient here was in the pool, for instance, and drowning, or had had a huge heart attack and was sweating beforehand, we do not want anything to do with water. The reason is why? Does anybody know? Go ahead.
Water generates electricity, or
Yes.
conducts electricity.
It does, absolutely. So an electrical shock, which the AED uses, will go right through the water. So we want to take them out of the water. We want to dry them off. The second thing is, if they have any medication patches, the medicine in the medication patch can interfere with the shock. So we want to make sure that that medication patch is not where we want to put our pad. our sticker. If it is, we just simply take it off, throw it on the floor. The third thing is when we take their shirt off and determine that we're going to put these pads on, if they're very hairy, the pads are not going to stick very well. So we want to do a quick shave job just over where we're going to put the pads. The fourth thing is some patients have internal defibrillators like this, but a much smaller device that's implanted. Normally it's about on this location, but sometimes you will find them over here where the pad goes. If you see one over here, all you want to do is make sure that you don't put the pad right on top of it. So the four things that we want to do before we attach the pad. We've already determined the patient is dead because they're not breathing and they haven't responded to us. The four things we want to do is make sure that there's no water, there's no medication patches, we've shaved where the hair is, and we're not going to put a pad where a defibrillator is. It looks like a little bump under the skin, honestly. So we've already addressed those issues. Now we're going to use the AED. Does anybody feel like they could demonstrate for me how to use the AED? You want to try it?
Sure.
Okay.
Begin by removing all clothing from the patient. Look carefully at the pictures on the white adhesive pads. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
You're doing excellent.
When the first pad is in place, no one should touch the patient. Analyzing.
The AED is analyzing the heart rate.
No one should touch the patient.
It's determining.
Shock advised. Stay clear of patient. Press the flashing orange button now.
What do you think we should do?
Press the button.
Deliver shock
Absolutely.
now.
Go ahead.
Press the shock delivered.
I'll
Be
simulate.
sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button.
Well, have you taken a CPR class before?
No.
We really should do CPR now. Why don't you press the blue button?
Place the heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
Wonderful. I'm going to turn it off now because we're done. Okay, so hopefully that looked pretty easy. AEDs are pretty fool safe. When they say they're analyzing, what they're doing is checking to make sure that this patient here indeed has a need to be shocked. If it doesn't have a need to be shocked, the AED will not shock. For instance, you could put it on me and the AED would pick up that I have a regular heart rhythm and it would not shock me. For this reason, AEDs are approved for public use. For this reason, you don't have to be certified in anything to use an AED. The reason that AEDs make such a huge difference is statistically, it has been proven that when somebody collapses from sudden cardiac arrest or their heart stopping, for every minute that an AED is not attached, their chance of survival goes down 10%. So as an example, if you see somebody collapse and it takes you 2 minutes to go get an AED and attach it to them, delivering a shock, they have an 80% chance of living. If it takes you 7 minutes, they have a 30% chance of living. So as you can see, time is very important. Do you think that this is a pretty easy device to use? Yeah? I think you could use it. Let's look at a real one just real quick so that you don't have any anxiety knowing how to use these in public. The real one looks just like the fake one. Would you come hold the fake one for me? Behind me down here so the camera can see. Fake one, real one. You see the same 3 buttons? Same 3 buttons. In the real case, there is a couple of devices to help us with the 4 things that we need to know about before we put that AED on. There's a towel for drying off water. There's a razor for shaving the hair. There's gloves for taking off medication patches. So that is always at your resource too. Now, since we've gone over the use of an AED, you guys think you could figure out how to use one in an emergency?
Yeah.
Yeah.
You think it's a great way to become a hero?
Yes.
Great! So I think you should go out and just really start paying attention to where AEDs are in the public and think about maybe going to find a local CPR class. Thanks for taking my class today.